New at 6, federal scientists say people living in Tennessee are more likely to deal with long COVID than patients in most other states. A study from the Centers for Disease Control say almost 1 in every 10 adults in Tennessee reports experiencing the symptoms of long COVID.
And that includes a loss of taste and smell, and in some cases, such low energy they can't get out of bed. 10 News reporter Vinay Simlot explains the challenges and what's next for people suffering with these lingering symptoms.
A life changed for Katie Allison.
You know, it's just been terrible. It's just terrible.
She caught COVID in July of 2020.
I have now been sick for 3.5 years.
The writer, gardener, the mom says she can't spend too much time out of bed.
If there's a glass of water next to me on my bedside table, I can't sometimes lift my arm to get the water.
She has fatigue and memory issues. She can't work. We had to reschedule our interview multiple times because Katie couldn't sit up. She took these symptoms to her primary care provider.
She was thriving before she got COVID.
Nurse practitioner Crystal Gibbons was stumped. Early in the pandemic,
Long COVID wasn't a thing.
Now researchers have learned more.
12 weeks or longer afterwards, you still are having ongoing symptoms.
Including Dr. Wes Ely at Vanderbilt's Critical Illness, Brain Dysfunction, and Survivorship Center. He says there's no cure, but there are ways to lower your risk.
The higher risk people are those who aren't vaccinated and those who get COVID many times.
More than 30 minutes into our interview, Katie started shaking. She was tired.
I just really want to lie down.
But she says by telling her story, she hopes more people will learn about this disease and how it changes lives.
I already feel like I'm missing out on so much of my children's lives, all of them, and I just, you know, and I feel like I'm such a burden to everybody.
Now, Vinay, it is worth underlining. Doctors say there's no test for long COVID, but again, run down those symptoms for us because they are long-term symptoms they're dealing with.
Yeah, and they can be super mild or debilitating, like Katie's symptoms. Tiredness, fatigue, brain fog, cough, chest pain, heart palpitations.
And you learned that even a mild case of COVID to begin with can turn into long COVID, Vinay.
Yeah, that doctor we talked to says you can have no symptoms of COVID and end up with long COVID. You remember, Katie never had to go to the hospital with COVID, but she's been several times for long COVID. And the doctor we spoke with stresses, get up to date on your vaccines to lower the risk.
Vinay Simlot with that perspective. Thank you, Vinay.